Hi, my name is Jada Hanson and I'm an enrolled nurse here at the Kalgoorlie Hospital. I love working here. It's a very community-driven town. I see a lot of people on the street and they tell me how much it means to me when they're sick and down and sort of in a pretty bad position to be in hospital. And when they're out and they're healthy, it really means a lot because it means that I've done a good job. So Kalgoorlie is pretty isolated from other towns surrounding, especially Perth as well, being the next city, which is 6 hours away for a drive. We get people that fly in from RFDS. They can come from down south in Esperance and all the way up from the lands. As an Indigenous person, I think working in the health space is really good. A lot of my patients are Indigenous and I feel like being sort of a familiar face, even though I don't really know them most of the time, just is a little bit more comforting to me. I feel like I can help them and I think they feel the same, that they can confide in me and tell me about their health, but also their culture and their family, which makes a good relationship between me and the patient. I recommend rural nursing, definitely. It's really good for the experience, but also the relationships I've made along the way are just like no other. It's very community-based. I could speak for Kalgoorlie, but a lot of country towns, we're really focused on community, and I play sports all year round, so the job is really flexible to cater to that. I have friends that have kids and they can attend their kids' events and school events and still have a really balanced and flexible work life.
My name's Tamara Bonney. I'm an Aboriginal Liaison Officer down in Esperance. I really enjoy my job, just to know that I'm helping our people, and it's rewarding at the end of the day when they thank you when they're at their most vulnerable time in their lives, and it'll take a bit of stress off of them. We support the Aboriginal community, whether it's from doing transports to doctor's appointments or going to pick medication up. And we also liaise between specialists up in Perth. We do home visits to go and liaise with them, and ED and all that as well. We can have telehealth, which is at the outpatient, so for various reasons that they can't go to Perth, we organise for them to have a telehealth appointment here in Esperance rather than go all the way to Perth. What they might know is when they fall upon hardship, there's plenty of services around Esperance. There's various ones actually that can help them, assist them with food vouchers. They have hampers, even clothing as well. Places that help them with driver's licence. We know services that they can connect up to there. And because some of the services they don't even know that can assist them, we point them in the right directions, otherwise they wouldn't have known. When people come in and they're feeling nervous about going in to see the doctor or anything, we're there to support them and help them feel at ease, but just to support them along the way as well. And don't be afraid to ask, because there always is support.
Hello, my name is Tanya Indich. I live in Laverton. I've been here all my life. My job title is with CHSP and the HAC at the Laverton Hospital, and my second job role is patient care assistant. My passion is to help people with their disability, help them with things that they can't do at home. With my job today, I'm going to be out and about. I'm going to be delivering meals to all the clients, collecting their clothes that we wash and take it out and give it back to the clients. Every day I do my job, it makes me feel good about it and I've achieved something. There are services here in Laverton, so if you need services, ask around and hope somebody puts you in the right direction to come to the Laverton Hospital, and we will provide you with the services you need.
My name is Bill Ring. I work at the Kalgoorlie Hospital. I work at community mental health, so the Aboriginal mental health support worker. I always like working with that mind mob and helping them live a better life and making sure that there's help out there if they need it, the support out there if they need it. And there's always someone there or some people there are willing to go over and above to help them get the right treatment or the right support. Passionate about that, and I'm passionate about what I do within the community mental health services. The answer, how we can work together and how we can solve this issue about people staying and try and get treated. In a day-to-day thing, we've got people coming in and they got the patients that stay and they take off, and that's where the worry is, that people go out and there's really something wrong with them, but they should be staying and getting themselves treated and getting the right medical care.
Hi, my name is Marilyn and I work at the Leonora Hospital, and my job title is a PCA and a cook. I've been working here at the Leonora Hospital for about 22 years and I'm really happy that I've been here the longest. I come in the morning, I do all the cooking, you know, and like you walk around the street and you think, oh, look at these poor people, what can I do for them? So I'm here, I cook, and when I go home during the day, I think to myself, well, I done a good deed today because that person I seen yesterday, I fed them to keep them happy and healthy, you know, so I feel better for myself because I help someone else besides myself. So if they come into the hospital and they to the front door and they're a bit scared, we just invite them in and we help them as much as we can. Don't be scared, we're here for everybody. So we just talk to them and they try to talk back to us so we can understand a bit what they say and a bit what we can't, but we still help them out, and if you need anything, we're always here to do it for you. What colour, what kind, what race, whatever, we're here for everybody.
Hi, my name's Christina Bevan. I work at Leonora Hospital and I'm a registered nurse. So I enjoy working at Leonora Hospital because we are a close-knit community. So we do know most of the patients who do present, and the patients do feel comfortable with us. So the number of challenges we find at Leonora Hospital is we are a small and remote hospital. So patients who do need further investigations and care do need to fly out to either Perth or Kalgoorlie Hospital. So I work with a lot of nurses and doctors who come from a lot of cultural backgrounds, and they always try their best to provide cultural safe care to the Aboriginal patients, and they're always on board with attending training or asking for feedback on how to provide care. Being an Indigenous nurse, an important role for me is to provide cultural sensitive care to our Aboriginal patients. So hopefully in the future I'd love to see more Aboriginal people become nurses or doctors and work in the healthcare setting.
My name is Candice Whitehurst. I am a proud Yamatji woman from the Midwest region, and I've lived in Kalgoorlie for 21 years. A big part of my role is education and prevention of sexual health, and also providing cultural safe support to government and non-government agencies. I think health is really important, especially in Aboriginal people. I like that I get to advocate and support mob and encourage them to look after their health. That may not know a lot around the healthcare system or may feel a bit, scared or shamed to come in and get healthcare, and knowing that I can make a difference with people to access healthcare.